Diabetes can serve up a lot of questions, like what is your glucose and can you have more carbs? Before you decide, know your glucose level and where it's headed with Freestyle Libre 2. Now with real-time glucose readings sent right to your smartphone. Freestyle Libre 2. Be in the know and manage your diabetes with more confidence. Now you know. Try it for free at myfreestyle.ca or scan the code on your screen.
Good day, my name is Cherylene Pinaroc, and I'm a nurse who works in diabetes, and I'm here today to speak to you about empowering yourself to manage your diabetes. These are my disclosures, and as you can see, I work with numerous companies in diabetes, and I'm also a certified pump trainer that I start insulin pumps on type 1s. Today, this is the stuff that we're going to talk about. So we're going to understand, discover, and learn about diabetes and sensor therapy. So basically, right now, when we talk about sensor therapy, we're looking at either flash glucose monitoring or continuous glucose monitoring. So we've got to understand the difference between the two. And as everybody knows, there's going to be a difference between capillary blood glucose, the ones that you test on your fingers, comparing to a continuous glucose monitoring. So if you're doing a flash glucose monitoring or continuous glucose monitoring, remember that we are measuring the interstitial fluid. Flash glucose monitoring is an action of pulling the data from the sensor. And then in continuous glucose monitoring, the action is pushing the data from either your telephone or your receiver from the sensor. So basically what the patient has to do in flash glucose monitoring is we still have to continue on scanning the sensor to get the information that we needed, compared to continuous glucose monitoring, where the information is sent directly without you scanning or doing any other action to get the information. As you guys know, the Freestyle Libre 2 system measures interstitial fluid like we're discussing. We all know that the capillary glucose sampling, whenever we test with a regular conventional method, that the needle is like inserted about 2.5 to 3.5 millimeters deep with pressure. We still need those steel lancets that everybody really hates of trying to prick themselves, and it hurts sometimes and is very sensitive on the fingers. And we also use test strips to collect the capillary blood to obtain the glucose sample, and then we get our value after that. Usually what happens is that there's a risk of sample contamination, and usually that's when we have like oil on our fingers or any sugars, and so this can falsify the readings that we're getting on the capillary blood glucose sampling. With the Freestyle Libre 2 or the continuous glucose monitoring, so basically what it does, it measures interstitial fluid. So basically the sensors are placed about 4 millimeters deep under the skin. It does need a metal inserter or a needle to actually put and place the sensor under the skin. So people believe that there's a needle placed under the skin to actually collect this information, but it's actually a small plastic filament that's placed in the interstitial fluid, which obtains the glucose sampling. And usually with the sensors right now, especially with the Freestyle Libre 2, it is a 90-degree insertion that lasts 14 days. Talking about the differences between the sensor glucose and blood glucose is very important, because usually when I have my patients come back to me and they say, oh, the sensor is not very accurate because it doesn't read the same thing as my blood sugar when I test on my meter and when it goes on the sensor. So it's very important to realize when we're talking about the differences is that there is always going to be a difference between a sensor glucose and a blood glucose, especially when there's different periods of the day or different periods of the times when you're either doing exercises or when you're eating high fatty foods, and you'll see a big difference. So usually when the sensor is stable is when your sensor readings and glucose readings are similar. So basically there's no change, you're a pretty flat line, and that's an arrow that you're going to see. And that's a straight arrow that's going a flat line. So basically your sensor could be reading at a 6.95, and so is your blood glucose too. So there's no change in values in that. Then there can be an action when you start seeing like there's a rise in your blood sensor readings. So basically, anytime you look at the blue, that's your sensor glucose, and then the red is your blood glucose of your capillary. If you see that your sensor glucose is a little lagging behind, because obviously your blood glucose levels will actually go faster. No matter if it's going up or going down, the blood glucose will always trend a little faster. So this this action, or whenever your blood glucose is trending up, usually what happens is whenever we start eating, we see that your sensor values are a little lagging behind, but your blood glucose are going a little faster. Then we see the train going up, but then it could also fall down too. So when your glucose level is trending down, it's obviously that your blood sugars, your blood glucose is going to be falling a little faster. So there's going to be a little difference between it. And obviously, like if some people don't feel fine looking at the sensor, you can always test it with a blood glucose just to make sure. But with the new sensor Freestyle Libre 2, there is no need to actually test whenever you're trying to make sure everything's okay, especially when you're in a low blood sugar. So it's very important to remember that it's normal if your sensor readings are different from what you see on your meter and what you see on your sensor values, if it's on your reader or on your phone. Especially in situations like when you're eating after a meal, when you've gotten insulin or when you're exercise, there's going to be a difference between those blood sugars. For most treatment decisions right now, like I explained, the sensor readings from the Freestyle Libre 2 system, they can replace the finger sticks now, especially when you're in low blood sugars too. So that's a good thing. I mean, compared when patients were complaining that they don't want to test, this gives a wealth of information. So it's actually helping with a lot of treatment decisions right now. So it's important now to look beyond the number. Okay, so flash glucose monitoring it's always good to look beyond the number. And we'll continue into that in a second. Basically, we all know an increase in time and range results in a decrease in A1C. Anytime that you have a increase of 10% in time and range, we can see that the A1C correlates and it can decrease about 0.8%. So your estimate of A1C for a given time and range level based on type 1 and type 2 diabetes is that every 10% that you're increase in time and range will decrease your A1C by at least 0.8%. They chose this as a consensus, basically, that studies were done, and they found that if you're in time and range of about 70%, that your A1C will correlate to about 6.7. And considering that we have with the standards of Diabetes Canada, and we're looking at the goals of having an A1C of 7 or less. And I know we're actually pushing that a little more to actually be less than 6.5 and going less than 6.5 already for diabetes. Like I said, we had an international consensus that sets clear guidelines for time and range. They looked at different studies and different values, and they recommended the time and range for most type 1s and type 2 diabetes and non-pregnant adults, regardless of their insulin therapy, that they wanted the time and range to be at least 70% of the time of their readings, and that's 70%, which correlates to about 17 hours per day. And when we speak about time and range, we look anywhere from 3.9 to 10 millimoles per liter. Obviously, when we look at reports with our patients, we also look for the time above range, which is about 25% of your readings. And that should be less, that's looking at anything from greater than 10 millimoles per liter. And the most important we also look at is the time below range, which is anywhere below 3.9 millimoles per liter. And we want that at least about 4% of the readings, which correlates to about less than 1 hour per day. And on the next slide, I'll explain that to you about what that means. So basically, when people are looking at their phones, this is what they see now with their screens for the Freestyle Libre 2. There's 4 important things that we need to look at when we're looking at our screens, and they will be, the first part we're looking at is really your current glucose value at this moment. Okay, and then the second important thing would be looking at your glucose arrow trend. This will give us a good indication of where your blood sugar is going in the next couple of minutes. So this can help with your treatment decisions to actually let you know what you need to do. The next important thing would be your glucose graph. Here, if you look here on the bottom, this is your last 8 hours of data, and that will actually help a lot of people decide on whether, if they're taking insulin right now, did they give themselves enough insulin? whatever they ate, did it spike their blood sugars really high, or did they give themselves too much insulin now that they're trending a little low? So this gives them a good indicator of how their treatment therapy has been going. And obviously, the last thing that we look at too is the glucose message. So for this on the phone, it will give us a color coding. On the meter, if you're still on the meter, it will give you a message of what is happening to your blood glucose. So those are the 4 components that we need to understand when we are scanning our sensor. So this actually, like using all this 4 important information helps us to decide on our next course of treatment. So this is actually the 4 important things that I always tell my patients. I always let them leave out of my appointments knowing that this is the 4 important things they have to look at whenever they're scanning. So basically, that's another thing we discussed is what these trend arrows mean and how fast they can actually change your readings. So when we look at the arrows right now, as you can see, there's 5 different arrows in the Freestyle Libre 2 system. So when we look at the arrows, we have a glucose that's rising rapidly. If we see an oblique arrow to the right, that means your glucose is rising. If we see an arrow flatlined, it's basically that the glucose is changing slowly. And then the arrow falling down is the glucose is falling not so fast. But then if we see the arrow going straight down, that means your glucose is falling rapidly. In terms of how the speed is, we're going to look at the glucose rising rapidly or falling rapidly. This can increase or decrease of about 2 millimoles in 20 minutes. So it's very important to look at your trend arrows and see what's happening, especially when you're doing exercise, especially when you're going to probably go for a drive. It's important to actually scan or look at your number to see where you are to make sure that you're not going to be going into hypo before you start any activity. So that's one thing to look at for. The next is going to be talking about the glucose rising or falling, and that can be anywhere from 1.2 to 1.5 millimoles in 15 minutes. So this is another indication of what you need to do if you need some treatment before you actually start an activity or take a drive, like I said. And the glucose changing slowly is about 1 millimole in 10 minutes. So basically, we're just looking to make sure if your glucose is trending is stable, that there's nothing that's going to happen shortly. And that's a great thing to look at also is, like I said, the different arrows. And now you know how fast that these values can actually change your blood sugars. So it's very important to remember these things, especially when you're, like I said, you're either going to take a drive, you're going to do any physical activity, you're going to go for a walk. Things like this is very important to look at. So one of the new updates right now with the Freestyle Libre and Abbott is right now is that they've recently did a update of a real-time glucose readings with the updated Freestyle Libre 2 app. Unfortunately, it's not available with the readers right now, but if you have the Freestyle Libre 2 on your phones, you are able to see continuously your blood sugar values. Okay, so basically with the reader, we still have to scan to actually pull the information out of the reader from the sensor to actually see our values. But with the Freestyle Libre 2 applications on your phone, it sends the glucose information to your smartphone every minute, and it's automatically displayed on the app. So there's no more scanning. I don't want to say there's no more scanning completely, because we do have to scan whenever we start a new session. But then sometimes there might be lack of communication, or there's missed data. You can always scan and it will fill in the last 8 hours of your data. So if it was less than 8 hours that you've actually scanned and it was like miscommunication or you left your phone somewhere, you can actually fill in that data to actually get all your readings as you wish. So basically too, I'm not sure if a lot of people know that there is a way that you can actually share your data with actually your loved ones. And with the new update with Libre Link up, you would get your glucose reading shared with a caregiver after each scan. With the new update, they could get it anytime they actually have a session running. And before the app update, I know it was annoying. A lot of patients would call me and say, oh, my caregiver or my loved one hates all the alarms, because anytime there was an alarm on before the update, they would get the alarms too, and then they would only have the shared alarms. After the update, now the caregivers can actually change these and customize their glucose alarms so they're not getting so many alarms at the same time. So basic things to look at is actually use your data. A lot of people just look at, I wouldn't say they don't look at the information. They do take the time, but they don't know what to do with it. So what do we look for whenever we're looking at your data? So there's basic ways that your data is captured. One of the ways that we look at is actually using LibreView. When you guys create your account on your phone, currently with the application, LibreView is automatically created, okay? And if you're using the readers, you would have to go into the website, libreview.com, and actually create an account, and then you can pair yourselves with your professional, a healthcare professional. So basically, the only difference is with the Freestyle Libre 2, you would have to connect your meter to your computer to actually get the data pushed and pulled from your meter to actually put into LibreView. On the telephones, it's already shared in the cloud once you actually create your profile. So that's one good way of using your phone. So if you actually have the phones, it actually makes life a little more seamlessly in data capture and actually getting your blood sugars too at the same time. One thing that we look for, which unfortunately is not available on the application, but a lot of professionals, healthcare professionals, use this reports. It's called the AGB report, or the ambulatory glucose profile report. It is not available on the Freestyle LibreView application on your phone, but it's actually available for you guys to look at on the LibreView website. So if you have your account, you could always sign in and look at this report too. There is 4 different graphs that help the healthcare professionals decide on what the next treatment will be. The first report that we look at is actually up here to your left, which is called the glucose statistics and targets. The next report is the time and ranges. The third report down here is your ambulatory glucose profile. And the fourth report down here is your last 14 days of your readings. So looking at this report, it's a one-pager. It helps the healthcare professionals just at a glance look at your stuff and say, okay, this is where we need to work on. So the best thing about these reports is that we could take it apart and actually go into a little deeper with the patients. So when we look at the glucose stats and targets, we look at what your average glucose is. So for this patient right here, it's actually at 12.9 millimoles right now. So we know we might have a little work to do, okay? The GMI stands for glucose management indicator, which we can compare to your normal A1C that you normally do every 3 months. So using your sensor data, they're able to capture what your A1C would look like with your readings. So with this patient, they're obviously, like, if their blood glucose is at 12.9, they're not a target with their A1C either at 8.9. The next thing we look at is the glucose variability. Here they are at 34.8%. We would target it about less than 36% to actually take these values and actually make a good treatment decision to actually change anything if we need to. Anything more than 36%, it's like they have a lot of variability in their stuff. So it might be good to err on the side of caution, maybe not to change, because their variability might be a little too high. Also in this chart, we actually could see the glucose ranges. Anything above 13.9, we actually look how much time they are above the 13.9 millimoles. Anything above 10.1 to 13.9, you can actually see how much time they're spending in there. How much time this person's in hypo. Anything below 3.1 and 3.9, this person is actually living at 1% of the, 4% of the time. And anything below 3.0, which is like something that we need to be careful of, is less than 1%. So this patient is somehow still not in target. So there's still a lot of work that needs to be done. And then we look at the second report, which is our time and ranges. This time and range is very important because this when we talked about the time and range, you wanted anywhere from 3.9 to 10 millimoles per liter. And we wanted this range to be at least 70% of the time. And as you can see, this patient's at only 28%, which is not that much. They've reached their target of 71% over target, and that's where we want to see the opposite of. So we would like them to actually be more in the green, less in the yellow and the orange. And as you can see here, they're not that much in very low blood sugars or low blood sugars. So when we look at it, we say about 1% equals 15 minutes of the day. So if this patient is actually having a lot more hypos, then they're spending, say, for example, if they're 4%, they're spending 60 minutes of their day in hypoglycemia. So I'm pretty sure there's going to be a lot of work that needs to be done, and probably a lot of discussions of what's happening, because we probably would have to change their treatments. The next one we look at is talking about the ambulatory glucose profile, which is called the AGP report. So this would be the blue line, the thick line here is actually your median of your values, okay? If we look at the dark blue values here, we could see this patient is very variable. As you can see, they go from up to down to very high. So these light dark blue values here are actually 25 to 75% of your readings. And if we look here at the outliers, these are basically your light blue or light gray, I should say. This is about 10 to 90% of your readings that are captured. So basically what we'd like is, like, we're looking here in the target range and how much and how often they're falling in there. And as you can see, this patient is very variable, like we saw with the other data. And that means that there are some stuff that we need to change for the treatment. The last thing that we look at in this is called the daily glucose profiles. So like I said, this represents like your last 14 days. So it gives us a good indication what happened on day by day with the patient. And sometimes, you know, if we need to actually look more, we could actually go into the daily profiles to actually see what's happening to them every single day. And we could see sometimes in meal times that they're going up, and at which meal times. And it looks like there are days when at supper, as you can see, that they're going pretty high. This could be a discussion with the patients of when they're injecting their insulin, what are they eating for their meals? Are they injecting at the moment they're eating, or when are they injecting? And then actually seeing the sites to make sure that, you know, we're not injecting in the wrong place, or we're not injecting in very like fatty deposits. So there's a lot of room. This report gives us a lot of room for opening discussions with the patients on their treatments and how we could actually help them better get their treatments in, and actually help them use this data to actually help you guys use this to actually help yourselves on realizing what you need to do and where you can help yourselves. And so this is like one of the best features of having all these reports now, is that you can actually be able to safely look at your data and figure out what's happening with you throughout the day to make important treatment decisions for yourself. I thank you, and I hope I know there's going to be a lot of questions coming on, and I'm thankful that for Abbott Canada for giving me the time to do this presentation. Hope you learned something. I know there's going to be more questions coming along, but I hope that you were able to take this information to help you empower yourself to actually help yourself with the treatment decisions from daily living with diabetes. Thank you and have a great day.